Bismillahirrahmanirrahim and Assalamu alaikum. Dear viewers, I hope you all are fine. Today let's talk about the cognitive development in children. Whenever we talk about the cognitive development in children, one name came in our mind. That is the great psychologist, philosopher Jean Piaget. Jean Piaget gave the theory of cognitive development in children. He has well explained that children develop cognition in four steps or in four stages, and he briefly explained these stages. So one have to pass from one stage, then move on the next stage, and later on. And each stage is important for the child, and each stage has different crises and different goals. There he explained that there are four stages of cognitive development: sensory motor, pre operational, concrete operational, formal operational. As the picture indicates, from birth to 2 years, it's pre-operational sensory motor stage. From 7 to 2 to 7, this stage is pre-operational stage. He termed this stage as pre-operational stage. Then 7 to 11 years old, it is called concrete operational, and 11 to onward is called formal operational. And child has different crises and different goals in these stages. Let's talk about the first stage, that is sensory motor stage, first to age 2 years. During this stage, the child begins to develop reflexes, habits, hand-eye coordination, object permanence, knowing something exists even though it cannot be seen. And in this stage, child has different goals, like he wants to speech. He has speech development in this area. He has a perception of self, others. His life move on the one circle, that is the mother figure, and he has very much attachment towards the mother figure. And in this stage, the child is seeing in the world that we are showing. He has very curiosity mind, and the child want to explore the things, and he wants to know different things that are moving in the life. Now we are talking about the next stage, that is concrete operational stage, and age ranges 7 to 12. During this stage, the child begins to develop the fundamental of logics, ability to sort objects, ability to classify objects, understanding of conversation. Physical quantities do not change based on arrangement and appearance of the object. In this child goals differentiate, and he developed these different goals, and he has these objects or these fundamentals in this stage. Now we are talking about the fourth stage of cognitive development, formal operational stage, age 11 to 15. During this age, the child begins to develop ability to hypothesize, test and re-evaluate hypotheses. Children begins thinking in a formal and systematic way. And one thing I want to share here, if your child is not on these stages appropriate, like in the age of 11 and 11 to 15, he is on the first stage, it means uh, he is delayed in thinking, he is poor in cognition. So if you are I just explained these four stages, and your child is lacking in a stage, either it's sensory motor, it's concrete operational or formal operational, it means your child is not up to the mark. Like if your child is speaking at the age of 5 years and you are saying it's okay, he is speaking uh, 2 words or 3 words like baba, mama, huh? It's not normal, because the normal speed developed at the age of 3 years. And if your child is and the next is, if your child is not crawling or moving at the age of 2 year or 3 year, he move independently at the age of 6 years or 5 years. It's again not normal. Don't take it easy. Consult to the specialist, physiotherapist, speech therapist, psychologist, whatever the problem your child has. And the last thing is, please be attentive if you are a mother, if you are a caregiver, for the child development, for the child cognitive development, because these are the points that are lacking in children with special needs. Early screening is very important. Early intervention is very important. Early intervention, when there is an early intervention, and there are more chances to recover. So, let's always, when you are bringing up a child, please do remember these stages of cognitive development. These are for the child normal growth. Thank you so much. If you like my video, please subscribe and share. Take care. Goodbye. Stay at home. Bye bye.